This is going to be about the reproductive system in the males. So the first thing that you need to find in a male specimen is going to be along the umbilical region. You're going to find the urogenital opening. So here is my umbilical cord, and caudal to that I find this opening right here, which is my urogenital opening. The next thing I'm going to find is my scrotal sac, which I use to identify my pig as a male. But I have this sac basically behind, underneath the tail. I have this sac here. Inside is where I'm going to find the testes. I'll show you that in a minute. It's to cut open the scrotal sac so that you can find the testes. So testes is plural for testicles. So here's one testicle, here's one testicle. Plural, they are testes. In order to get a better view of the penis, what you're going to do is you're going to peel off the skin at kind of in that umbilical keyhole that you made. And then what you're going to do is you're going to separate out the penis from the bladder and the umbilical vein. So I've separated it out. I have this piece right here. So this portion is my penis. I still have got my bladder, which is the tan one, and then I've got my arteries on my umbilical cord. But you do kind of have to pull up at the penis and use the scissors in order to cut in between those layers. So the urethra is inside of that penis. So it's just the tube. It's going to transport it all the way into the urogenital opening. Female pig, what you're going to do first is find the urogenital opening. And the best way to do that is to find the urogenital papillae, which is just this opening or this little flap that kind of distinguishes it as a girl. If you kind of lift that up, you'll see a hole. I know this isn't really in focus, but you'll see a hole directly under that flap. That is the urogenital opening. Then what you're going to be able to find, go back into the abdominal cavity here. There are some very thin, tightly coiled tubes. And at the end of that, you'll see something kind of loby. That's going to be your ovary. What's directly attached to the ovary, a very thin portion of that tube, is going to be your oviduct. Now, the horn of the uterus, or the uterine horn, is going to kind of come down here. You have one coming from the left side and one coming from the right side. So those are the horn of the uterus. In order to find the vagina, urethra, and uterus, you had to cut through the pelvic bone and cut through the muscle down here. So once you've done that, find your uterine horns, and where they're attaching together is going to be your uterus. All right, so if you kind of can peel apart where your bladder, remember your bladder's like on that keyhole that you guys cut out while you were getting into the abdominal cavity. So you got your bladder, and then you've got a tube coming off of it. That's actually your urethra. But then if you look closely and you can peel away some of the connective tissue, you'll see a second tube. That tube at this point is actually your vagina. So you've got your vagina, and then as you go up towards the uterine horns, you will feel kind of a little muscular portion. That's the cervix. You don't need to label that. But once you're past the cervix, then you are at the uterus.